Frontal sinusitis causing epidural abscess and puffy tumor. Sinusitis. Sinusitis is an inflammation in the lining of the sinuses around the nose.
During normal respiration, air travels through the nose and into the lungs. Inside the bones of the skull are air pockets called sinuses. The four major sinuses that drain into the nose and throat are the frontal, maxillary, ethmoid, and sphenoid. Sometimes foreign particles get past the cilia of the nose and enter one of the four sinus cavities. The sinuses are also equipped with cilia that push mucus and particles out of the sinus cavities. The sinuses then drain into the nose through a hairpin-shaped tube called the ostium. If the cilia are unable to push the mucus through the ostium, mucus can collect in the sinuses, blocking the pathways and causing swelling and inflammation of the membranes lining the sinuses, a condition called sinusitis. Sinusitis often develops following an upper respiratory infection or allergic reaction.
Epidural abscess. An epidural abscess is a collection of pus between the outer covering of the brain and spinal cord and the bone of the skull or spine.
Epidural abscess. An epidural abscess is a collection of pus or infected material between the outer layer covering the brain and the spinal cord and the bones of the skull or spine. The abscess causes swelling in that area. Causes, incidents, and risk factors associated with epidural abscess. First, epidural abscess is a rare disorder caused by infection in the area between the bones of the skull or spine and the membranes covering the brain and spinal cord, the meninges. This infection is called an intracranial epidural abscess if it is inside of the skull area, or a spinal epidural abscess if it is found in the spine area. Most of them are located in the spine. The infection is usually caused by bacteria. Staphylococcus aureus is the most common organism, but may be caused by fungus. It can be due to other infections in the body or germs that spread through the blood. However, in some patients, no other source of infection is found.
Puffy tumor. Rare complication of frontal sinusitis characterized by swelling and edema in the brow. Application in mice. Regarding sinusitis is treated with surgery and the use of antibiotic drops, aerosol, or decongestant. Disadvantages. People will feel pain in the paranasal area, nasal obstruction, difficulty sleeping, cough, and fever.
When the nose becomes congested, it usually becomes congested acutely or suddenly when there's a sudden change in function. The sudden change in function could be cold. So a virus, a bacteria can get into the nose, and the tissues in the nose, in order to prevent more of this bacteria and more of these viruses coming, tend to swell up. And so if you don't breathe through your nose, you get unfiltered air that goes into the throat, and now all the pollutants and bacteria and viruses in the environment also goes directly into the throat. So with a cold, you get this blockage acutely. If you're allergic, a similar process occurs. And if swelling is not relieved, there's a tendency for the fluid in the tissue to build up, and a polypoid or polyp is created, which is a more permanent swelling and not as easily reversible.
Diseases. Meniere's disease, blindness, laryngitis, paranasal abscess, and brain abscess.
The inner ear has fluid-filled tubes called semicircular canals or labyrinths. The canals, along with the nerve in your skull, help interpret your body's position and maintain your balance. Meniere's disease occurs when a part of the canal called the endolymphatic sac becomes swollen. This sac helps filter and remove fluid from the semicircular canals. The exact cause of Meniere's disease is unknown. In some cases, it may be related to a head injury, a middle ear infection, or even syphilis. Other risk factors include allergies, alcohol use, fatigue, recent viral illness, respiratory infection, smoking, stress, and use of certain medications, including aspirin.
It is all. Thank you.